Welcome to the fifth episode of the Pre-Health Purple Hawk podcast, brought to you by Pre-Health Advising at Hunter College. My name is Isaiah Keynes, and it is a pleasure to welcome Macaulay Honors alum and NYU Grossman School of Medicine graduate, Michael Mazzeo, who is starting as an intern psychiatry resident at Mount Sinai Morningside West. He graduated from Hunter College as a valedictorian alongside with his twin sister, Marie, with honors in his major in biochemistry and a minor in human rights. Welcome to the podcast.
Thank you.
So I guess we'll just get started right away. So yeah, this is the question that all med schools love to ask. So sorry for asking it, but what inspired you to pursue a career in medicine?
Yeah, I think it's a great question, and it's a question that you're right. It'll totally come up on your med school interviews at some point. I think there was a couple different factors. I mean, I think just to start, my mom's a nurse, so I did have somebody sort of in like the healthcare field that sort of gave me some interest in that. I also sort of started Hunter College, not exactly sure if I wanted to do medicine, but had some inkling I might want to. So I sort of went to the pre-health office pretty early on, met Camille like right around when I first started school. And then in addition to that, sort of just like took the science classes I went along. I always loved science, and science communication is really important to me. And I think so that really bleeds into sort of medical communication. So I think my lens into which I sort of approach medicine was in a very education perspective. And I'm still definitely doing that. So I think even at Hunter, like things that sort of like further pushed my interest into medicine. I did pre-health exchange, which I think still exists at Hunter College, but I really loved doing that when I was there. And I think being able to work with sort of like teenagers, sort of talking about different sexual health and mental health topics really sort of showed me that that was something I had a big interest in. So I think ultimately it came down to me choosing between a career fully in education versus a career in medical education. And I think sort of the route I took to that was ultimately medical school. It's also just really fun being in school, I think. So I think sort of like having that journey and really learning a lot of medicine along the way was like really, it's like just an awesome pursuit. And I think you really get to help a lot of people and really help people sort of like make the most of their lives and sort of like integrate healthcare into that. So
Mm. Yeah, honestly, I mean, that's an amazing reason. I mean, I feel like that's a reason that's really overlooked when you think about medical school is that you're there to learn too, you
yeah,
know. And I a lot of people say like medical school is really stressful and all, and which is true. Um, I think also though there's the reward of that you're learning things that maybe not a lot of people learn, that
yeah.
go to medical school. So I mean that is just an amazing reason that again I think is overlooked. So of course. So yeah, medical school, of course, you have to apply, and I'm pretty sure you went through that entire process. So
Oh yeah.
how was that journey? How was your journey applying to medical school? And of course, do you have any tips for current pre-medical students?
Like it's a great question. I think the application process sort of goes through a couple different variations. So I think the first thing you really need to do before you're applying is really make sure you have like a well-rounded and prepared application. I think sort of a plug for the pre-health offices, they do a really great job of sort of sitting you down and showing you what sort of components can be really important for that. So I think having like an honest and important sit down with yourself is a really good thing to look at what sort of things have I fulfilled and what things do I still need to fulfill. I know this is a question that's come up later, so I won't talk too much about it, but I did take a couple gap years, just sort of like first for personal reasons, but then also to sort of like maybe meet some more of that stuff that I was trying to fill in for my application. So I think like being really honest with yourself about your application. I think also taking the appropriate amount of time to study for your MCAT, like that is sort of your one standardized test that is across the board across all universities, what they're able to look at as like a metric to even you out.
Mm.
Some schools sort of have harder pre-health curriculums than others. So while your GPA is definitely important, and I do sort of stress doing really well in your science classes and sort of stuff like that, the MCAT is something that's going to be like really heavily looked at. A lot of the top schools, honestly, unfortunately, I think sort of use it as a screening tool. So if you're below a certain score, they won't even review your application. They sort of like throw it out right away. That's not to say every medical school, but sort of like some of those higher end ones, if you're looking to try to hit to like a mid to high tier medical school, really the MCAT's going to be really important
Mm.
in order sort of succeeding there. And then sort of in addition to that, like while I mentioned sort of wanting to hit like goals, so to speak, of like having some research and maybe having some teaching and like doing well in your science classes, having shadowing and that sort of thing, really doing things that you love and things that you're interested in. So the clubs that you do shouldn't necessarily just be because it's fulfilling a requirement. Like you want to be able to talk about it. And when it comes to interviews, that it's going to come off right away. Like there's going to be a genuine factor. Like, do you actually really like this thing, or did you just do it to sort of like fill some sort of requirement? So you want to have something you're passionate about. So for me, that avenue was teaching. I always really loved teaching, and I thought that was like a really important process for me. So I did a ton of tutoring in undergrad. I mean, I went off and did like a Fulbright teaching English for a year, which again, I guess in this sort of gap year thing will come up. And I did a lot of sort of like teaching programs, be it peer health exchange and some other outside high school peer mentoring programs when I was in Hunter College. So I think a lot of it is really like finding your niche, finding things you're really interested in. It doesn't necessarily have to be in science either. I think like a lot of med schools really love being able to see students from different varying backgrounds and doing interesting, cool things. And you may not think it's necessarily important in medicine, but it totally can be, right? So if you're working on like a human rights project or some sort of like humanities thing that really interests you, like that could be really important in terms of both medical communication, but also in terms of just like building rapport with your patients in a lot of different ways. So really like finding what you like and what you're good at and really sort of like honing in on some of those things I think is really important. In addition to that, take the time to write your essays too. I think those are like a really important reflection. I mean, unfortunately, you do interviews and people will get to meet you in person, but a lot of it is also like what they see on the paper. So really being able to have like a strong set of essays when you're applying, be it your like, I think it's like your 10 experiences and then your three most memorables that might have changed since I've been there. So I would like look into that. But then also sort of like your personal statement and stuff like that too.
Right. Well, this was all really great advice. I think really want to hone in on the doing what you love, because I think that's never something I really actually thought about is that like it would be really easy for you in an interview to like expand on what you did and what you gained from it if you loved it, if you loved what you're doing. So I mean that's a really good piece of advice. And I have a lot of like friends and other pre-med students who, you know, do things to again fulfill a requirement, but also over time they do start to enjoy those things too. So yeah, I do agree, try to love what you're doing and do love what you're doing. So yeah, thank you for that tip. So again, you went to Hunter College as a pre-med student. So how was your time at Hunter as a pre-medical student? Yeah.
Yeah, I loved Hunter. I mean, I think it's a really great experience. I mean, I think as someone who's also goes to Hunter, I definitely identify some of the challenges. I mean, I think having really big class sizes can be tough, particularly in like really difficult science courses where you feel like you want that one-on-one individualized attention. So I think that might be the one sort of challenging aspect. But even with that being said, I think something I did that was really helpful is really just approaching office hours and trying to like make that time to work with professors. And I mean, I think some professors are more receptive to it than others, but another great thing about like the Hunter pre-health courses is that you have a lot of older students and a lot of those older students end up becoming like teaching assistants and stuff like that. And we all go to this like public CUNY system, we're all really trying to lift each other up here. And I think that was one of the other things I really loved about Hunter too, is that like it's really a community that's constantly working together with each other. We know sort of like the limitations of the system and try our best to sort of like work with each other. So I think going to teaching assistants and like going to office hours in those capacities too can also be really very helpful. And I think finding a strong group of friends that you can rely on in terms of being able to study with and stuff like that. I still have sort of like my three best friends from college that we like studied with all the time together, like spent hours and hours and hours in the library, and like really did like these like 100 200 page like organic chemistry like review sheets, which were really long and tenuous, but I think almost fun because we were doing it as a friend group and sort of like staying together and working together. And so I think finding your friends that you work well together with. You can have friends that you don't study together with because you're not necessarily the best study partners. So I think the things for me that worked really well were like having a good group of friends to work with that I knew I could study with and do really well with, and then really approaching sort of like the teaching faculty being very open and receptive to working with you. I think that's one of the things that's also unique about Hunter is that some of our teaching faculty is truly just designed to be teaching faculty, and that's not the case at a lot of other private institutions. A lot of the professors of science classes are also given responsibilities in terms of research and stuff like that. And I think when that happens, you could sort of get a loss in terms of like the ability of how good the teacher can really be. Whereas like at Hunter, I think there's some faculty that are truly dedicated to just teaching, and that's their full job, and it sort of shows because of how well they do. But
Yeah, I 100% can vouch for that experience. I mean, I would not have been able to get through Bio 100 without my TA or
yeah,
TAs actually, I mean, they are such an amazing support system. I can also agree there are a lot of STEM professors at Hunter that of course are dedicated to just education, and I can definitely see those effects. And I think it's really important that you bring this up because I think that's also, again, something else that's, a lot of people tend to overlook is that, a lot of the faculty at Hunter are there to help you, and you should really take advantage of that help if you want to succeed. So yeah, I 100% agree. Um, so you are also a fellow Macaulay Honors student.
Yeah.
So how did Macaulay Honors specifically support you on your medical journey? I know you spoke about Hunter, but how, if there was any way that Macaulay Honors helped you specifically?
Sure. So I think one of the unique parts of the Macaulay program, particularly, is sort of the advising and sort of the strength of that advising core. I know that Lev is still there, for example, the director, and then my advisor was Charlotte. She actually just left about 2 or 3 years ago, but all the other advisors from when I was there, which is now what I started almost 9 years ago, which is almost shocking that that's how long ago I started. But that whole advising team is still there. So I mean, you have like Chris and Vasily and Joanna, and they're all like wonderful. I
Mhm.
think so, like being able to have a really close knit set of advisors is really, really beneficial and helpful. And sort of they are also willing to work with you on some of these essay components I was talking to you about before too. And so even for sort of like the Hawk listeners that are not Macaulay advisors, there are other writing, like the writing center and stuff like that are very, very beneficial when it comes to like the sort of like essay components and stuff like that. I think learning to be an efficient writer, particularly when it comes to making applications and sort of like med school applications, can be a really tricky thing. So I think being able to work with advisors is like one of the really unique parts of Macaulay that is really beneficial. I also think, like I said, it put me around a lot of like-minded peers. I mean, I don't know about you, but I feel like every other person I met when I first started at Macaulay was also like a pre-med. And granted, that changed to an extent. I mean, I know Hunter is known for being the pre-health program, which is why a lot of the Macaulay Hunter students are pre-health. But then sort of it really helped me sort of like get my feet a little wet and get a little comfortable, I guess, with like knowing some classmates like when I started right away. But definitely that's not to say you're like an only Macaulay student, because I definitely branched out and met a lot of really wonderful friends that were not Macaulay students and have done like incredibly well on the med student journey. But yeah, I think the Macaulay factor, the really most beneficial thing is like the advising. That's like really, really helpful.
Yeah, again, I can also vouch for the advising. I mean, we go to a really large, well, we, you also,
Yeah,
like,
I hear you.
going to a large public college, it's really hard to navigate, what classes to take, when to take those classes, and things like that. It's in order to become successful on your pre-health journey. And I don't think I would have been able to without my advisor, specifically Vasily is my advisor.
Yeah,
And I would right now I would not be here interviewing
I
you if
hear you.
it
I
wasn't
hear you.
for, yeah. So I 100% agree on that. So, and now moving on to what seems like will be a very good answer coming from you. Did you take a gap year between undergrad and medical school? And it seems like you did. So, of course, what did you do and how did it help you on your med school journey?
Sure. So I think it definitely helped me a lot. But like I'll preface this question with saying that there are a ton of people in my med school class that did not take any gap years and did it incredibly well too. So I think it's truly up to you. And I would say you shouldn't feel pressure to take a gap year just because you think it will like help your application. I would only suggest doing it like if you feel like there's things you need to take care of beforehand, or if you really have something you're going to be passionate about and want to do in a gap year. So for me, I took 2 gap years. And so part of the reason for taking two was because I did a Fulbright in Spain,
Mhm.
which at the time, this was like the pre-COVID era. So there weren't like virtual interviews, they were all in person. And it would have been just like incredibly difficult scheduling wise. And I also think it would have both like hampered my med school interview experience and hampered my Fulbright experience if I had sort of been bouncing back and forth. So I was sort of between doing the Fulbright, which I ultimately was really lucky, got accepted to and did that, versus doing like Teach for America, which would have also been a 2 year commitment. So I think no matter what, I was looking at like 2 gap years. And so you see like this teaching sort of like theme that has been throughout my application process. That was sort of like my angle, so to speak, going into medical school. So it made a ton of sense that that was like what I wanted to do in my gap years and research years, that sort of thing. Like I have other friends who were very like in the EMS world, for example, and then they sort of did a year doing like disaster management, like a disaster management project, that sort of thing, and like doing EMSing on the side. So like people find their like interest and like things to do. So I would say sort of like find, if you're going to do a gap year, find something you're really interested in doing and sort of pursue that. The other reason, like I said, would be if there's something you need to work on your application. So for example, if you feel like you're not quite ready to take the MCAT in time to apply, totally okay. Push it back, take it, and then you could sort of like do a gap year job while you're waiting.
Mhm.
There's also tons of valuable like medical experience, if you want to do something like that. Like a lot of people take scribes, like do scribing in their year off and things like that. I would say like gap years are, some people feel really nervous about taking them, but I think they're actually really, I think they're important. And like I said, I think it helps you build a little bit of perspective on sort of the world before you jump from just like one education building to the next.
Hmm.
It definitely, I think, helped me out a lot when I was like navigating the med school experience. So that's my long story. But just a short story, I took two gap years. So the first one I did the Fulbright. I did like teaching English in Spain, which I really loved.
Hmm.
And like I said, part of that was like being able to prepare my application, do interviews would have just been very, very difficult. So I decided to take the gap year, the second gap year. And so I came back home from the Fulbright in like June of 2019 and then worked on my applications that sort of like spring into the June, like its first submission of your like primary application season. And then in the meantime, I was like working on getting a job here. I ended up doing like research at Mount Sinai for a year. I did some like colorectal cancer public policy sort of facing research for a year, which was really nice and fun. It was a really cool project. Um, while doing my interviews and stuff like that. So I was able to work it out pretty well for me in terms of taking the two gap years. Um, but like I said, I think if you're gonna do it, try to find something that you really want to do. Again, it's gonna come up on interviews and it's gonna be very obvious if you're on an interview and they're like, "Oh, well, what are you doing with your gap year?" And you're like, "Oh, I'm scribing," like whatever. Like you're clearly not interested. But if you are like, yeah, I'm like doing scribing and I'm really excited about it and I'm getting to do like meet all these cool doctors and work in this like, I don't know, derm clinic and I've always had it, it's very like your interest can pop out. Um, so I think really think critically about what you'd want to do with a gap year if you're going to do it. But I think more and more students are starting to take them. I think the average years off before starting med school now in the US is around 2 years. So
Hmm.
granted, some people do less, some people do more. So it's sort of like a balance. But
Hmm. Wow, so that's really great to see that gap years are really helpful. I mean, you got into NYU. uh,
yeah,
so
yeah, worked out for me, I guess.
yeah. So that, I mean, that's really hopeful right there. I know like we're all stressing right now in undergrad, scared that what we're doing right now is going to have the largest, like most significant impact on our applications when, gap years do exist and can allow us to grow,
100%.
you know.
Absolutely.
Yeah. So I mean that's really great that you are a witness to that. You are an example of that. So yeah, thank you so much. So again, you went to NYU, you made it, you were one of the many survivors who got through the pre-medical journey. So you graduated medical school just like this year, right?
Yeah, like a month ago. So officially Dr. Mazzeo as of like a month ago, a little scary, but it's okay.
Well, congratulations, Dr. Mazzeo. How was your medical school experience? Yeah.
I love medical school. I think that it's like such a unique and sort of special experience that very few people get to actually do. And you really get to like, one, you really learn a lot of pathophysiology. So sort of like the earlier parts are truly like undergrad on steroids in a lot of ways, where you're just like pounding through organ systems really quickly and you're like learning in a really high paced environment. I think the most special, unique parts of medical school are really the relationships you get to build with patients and also your classmates. I think for your classmates, it's like you're all going through this very intense experience together. And so like there's a lot of sort of shared learning and sort of shared experience making that you get to have that I think a lot of other people don't get to really do that sort of experience. And then with patients, I think a lot of the patient encounters you have are just like really memorable and special for their own reasons. I think you learn very quickly in medical school that like, yes, you need the medical knowledge as a basis, but if you're not a good communicator with patients, you're never going to solve like their medical problems in a lot of ways. One, because you're not going to get buy-in from your patients, but then two, also you learn like from literally day one in medical school the importance of a medical history because that can give you so much more information than just what the patient's presenting with, like symptom wise and stuff like that. Um, but like I said, medical school is a really special journey. It's hard. It's not easy. I think you work really hard. You work a lot. But it's totally worth it at the end. I think preclinical is not as bad as people make it out to be. I always hear this trope. Sort of, I used to be a TA in the biology department too, so talked to a lot of first, second years, and like, oh, when I start medical school, my life's over. I don't have time to do anything. I would say that's not true. People definitely build time into their schedules to sort of like hang out with their friends and sort of do things that they enjoy and they care about and they like. Maybe some research and stuff too, depending on like what field in medicine you want to go into. And I can sort of touch upon that. So I'm doing psychiatry, which I think is really, I love psychiatry and it's a really wonderful field. It's not necessarily as competitive as some of the other subspecialties might be. So like dermatology, orthopedic surgery, some of those are like a little more competitive in terms of getting in. So it's a bit of doing really well on your boards, which are like step one and step two. So sorry, MCAT is not the end of your board exams. And then sort of like also like having research and some experiences sort of in that preclinical area, especially because during your clinical year you will get very busy, which is it's much busier than your preclinical years because you're in the hospital every single day, but also still expected to sort of go home and study for your like exams in each sort of unit that happen every like 4 to 8 weeks, depending on how long that unit is on the clinical service.
Mhm.
Uh, but like I said, it's hard, but you reflect on it, and it's just like such an awesome, cool thing to be able to do. And at the end of it, you get to do like the best job in the world. You know what I mean? So,
Wow, so that's great. So it seems like you had a really amazing medical school
yeah,
experience.
it was awesome. I mean, every school comes with their challenges, and so there's definitely unique things, I guess, anywhere you go that's going to be challenging. But overall, I would say it's a very positive experience. So,
I know at the beginning of this interview, you talked about how like education was one of, your biggest motivators. And I can assume that you achieved that, that goal of being able to get that education that you fought really hard for. Yeah. So yeah. Um, So you also brought up how like there were challenges, right? You went to you went to NYU medical school, and now you're a psychiatry resident. So we're all thinking right now that you're like the smartest person in the world, right? But I do assume that there were definitely some challenges on the road. So did you face any challenges on your medical journey? And if so, what were they, and how did you overcome them?
yeah, 100%. I mean, I think no matter what you do, you're going to face challenges, and like it could be easy to like reflect on what I've done in the last 12 years and be like, wow, he just went from point A to point B to point C without sort of any road bumps and things like that. I think I definitely like struggled early on in some of the pre-health classes that sort of required some course correction. I could
Mm.
tell you like Bio 100 back in the day, you used to be able to sort of like drop an exam. I totally flunked one of the exams, like really, really bad. And it was definitely like one of those things where I had to be like, oh man, that's not good. We need to sort of figure this out really quick. Um, so that was definitely one challenge for me. I think sort of like I said, I had sort of this decision point to make, like, am I going to go to medical school or not? Which was like another challenge, like really trying to figure out, do I want to just pursue a full career in teaching versus medicine? And I think sort of like, you have these day-to-day challenges too, where sometimes you feel really overwhelmed with the amount of work you're doing and sort of like, is this worth it? Like, and what am I doing? Like, why am I in the library for the 10th hour, like still studying this organic chemistry when like my friends studying something else or like outside or having fun or like going to the park? So I think like there are going to be times where you sort of like question, like, am I making the right choice for myself? And I think you really got to like take that space sort of, if you need a minute, give yourself a minute. It's going to be okay. You know what I mean? So you definitely will face sort of like, because maybe I'm coming from the psychiatry perspective where like I'm very pro mental health, but I think really, really give yourself the space you need when you need it. You know what I mean? And really like be able to say, okay, I need to take a minute and pause here and sort of like reflect and recognize that it's a long journey. You're not the only person struggling. Like a lot of other people are like, it's not easy for everybody. Nobody is going through this like skate free, like, oh, I'm like, whatever. Um, so just really like I said, I think reflect, but also talk to your friends. You know what I mean? Like if you are struggling, your fellow pre-health buddies probably having a hard time too. So sort of like check in, see what's going on. You know what I mean? I think even during the application cycle, things can get really frustrating and sort of like really overwhelming. And maybe you're like nervous about how many interviews you got pretty early on. I ended up at NYU, like I said, but sort of like the initial email I got from them was like, oh, your application's on the wait list right now. You're on hold. We don't know if we're going to give you an interview, which was really like, I mean, obviously it's a really hard school to get into, and I'm like super grateful I ended up there, but it was a little disappointing. I'm like, I really wanted to go there. That was like very much my top choice, especially given that it's like free tuition and everything. Sort of was like, okay, you know what? I still have all these interviews I have to like focus on and work on those. And then sort of ultimately obviously got an interview at NYU and it like worked out and I got in, but everyone's journey is going to be a little different. I would say even like my friends who all ended up at like these amazing different medical schools got very different interviews. So I would say it's not like a reflection on you if you get an interview at one school or not. There's a ton of schools I did not get interviews at, and there's a ton of schools I did, right? So just like trust that it's all going to work out. You know what? At the end of the day, as long as you put in the work and you sort of like meet the metrics you need to, you're going to end up somewhere. And it'll be a great experience no matter what. But
Great. It's really really inspiring to hear. Yeah. I mean, I always assume that like on that medical journey that you're definitely going to have those times where you're just like is it worth it? Is it worth all this stress? Is it worth sitting in the library for hours on this orgo, study guide? But it's really, I mean, it's there's evidence to see that, hey, you made it, you went through it. And I can definitely, echo that we'll all have our own different paths. And it's there's a lot of things that are up to you, but there are also things that are not in your control. So yeah, 100% agree with you. So yeah, just again, the medical journey is long, tough. I mean, I can emphasize on the long and I can emphasize on the tough.
I
uh
hear you. I hear you.
but have you found time, during that journey to do things that you love, outside of the academics, outside of the, research or extracurriculars? Did you do things that you loved? If so, what are those things?
Yeah, absolutely. And I think you can't maintain a career in healthcare without doing those things. Like I said, I think it's important to take care of yourself and really like ground yourself and remind yourself about things that you really care about and like. I think taking time away from medicine and time away from those like mandatory, like check the box activities is ultimately what's going to be able to restore you and really give you the energy to do those things and show up with your sort of best possible face. Even in medical school, where you're like, oh man, it's so busy and this and that, it's like way more busy than free health. You still find time. I mean, I really love to travel. So like every opportunity I've gotten, I've sort of like bounced around somewhere, like to some sort of country or something like that. And I could say like I didn't really leave the country for the first time until I was like 19 or 20. And I've definitely hit like over 20 countries and like done like a lot of things in terms of being able to move around. And then I think in addition to that, sort of like I really like hiking and stuff. I mean, New York City doesn't really allow that too much, but like being able to Central Park or like I've been like on a city bike membership, so like being able to bike around, be able to get out of the city sometimes and do like hikes that are a little more local and that sort of thing.
Mm,
Spending time with friends is really important to me too. I mean, you're in New York. I'm assuming from Macaulay or somewhere either in the five boroughs originally or somewhere in New York State. So with that being said, I'm sure you have high school friends here. Now you have college friends here. I went to medical school here, so I have medical school friends here. So it's like really being able to like find time for them too has been like an important priority for me. So
mm.
I think you learn over time how to be better with time management. Like that's just a skill that comes with sort of the territory of having less and less time to be able to work with. But like you definitely have time to do things you love and enjoy. And I think if you're finding that you have zero time for that, like take a pause and like reevaluate. I think there's definitely certain times that maybe you lose time for that. Like for example, say the like 2 months before you're taking the MCAT. I
Yeah.
totally understand if you lose a lot of time for free time there because you're really like honing in. But I think over the course of like a longer period of time, if you reflect and you're like, you know what, the past 5 months I like haven't done anything I enjoy. Like let's like time out, pause for a second. Like why is that happening? And like where can I sort of address and fix that a little bit? Because like I said, you need those restorative times in order to like perform your best in the things that you're like working on and striving towards. So
Well, that's very reassuring to hear that you were able to do a lot of the things that you loved, especially, going to med school in New York City. But, getting that city bike membership that, that I might actually start doing that. I love riding, I love to ride a bike. So, that sounds like a really good activity to do. But
make sure
yeah,
you wear
mm, right.
just make sure you wear a helmet if you're gonna ride the city bike. It's
Okay,
really
you're
important.
right.
I don't want any brain injuries, keep that brain protected.
No, you're right. New York City is dangerous. So yeah. um, So yeah, I mean, and yeah, I mean, there's no way that a person could even go on a medical journey without doing what you love. I mean, unless you're a robot, but we're not. We're all human doctors, at least for now. So, and that with keeping that in mind, it is important to do what you love. So yeah, thank you for sharing that. So you got through medical school. Congratulations again. And now you're in residency, and I'm assuming that the process of applying to residency must also be hard as well. So how was that journey applying to residency? And would you say it was harder than applying to medical school?
I think they both present their own unique challenges. I would say applying to med school is a bit harder, to be completely honest with you. I just think you have a lot more bases to cover. And sort of, like I said, there are times you're doing things you don't necessarily want to do. You're sort of doing it to check a box in some ways. Whereas I think in medical school, you really have the opportunity to hone in a little more on things you really care about and want to focus on, especially as long as they're geared towards like what career you ultimately want to have in medicine. Um, Again, I think it comes down to what specialty you're applying to in a lot of ways. Some are much more strenuous and like intentionally challenging than others, I feel like. And to be honest, I'm not quite sure why. I mean, it just probably has to do with like less spots with more people interested in them, so to speak. But I think in terms of medical school applying to residency, I think it was the medical school application. Everyone is in medical school and everyone's applying to residency for the most part. So your education is sort of tailored throughout in order to like set you up for that sort of goal at the end of it. Whereas I think sometimes in med school and undergrad, it can be a little difficult because you're sort of taking science classes with people who are also doing like PA school and NP school and are doing PhDs. So you're sort of like a lot of you are in the same place, but you're all being whisked to like very different career paths with have different requirements to get into those schools. Whereas this is a little more streamlined, I think. And I think in addition to that, sort of like the residency application, I think it's a little less. You still have to write a good amount. Like you still have your personal statement and you have like your most important activities and that. But I
Mm.
think it's a little more condensed, and I think it's a little less writing necessarily than the sort of pre-health writing. There's also very few secondaries, I would say. In the residency application, there's like maybe a couple. Some programs require them, but I would say like 90% don't. So it's a lot more straightforward. You submit your initial application, you do some like regional preferences, there's these thing called like stars, and depending on what residency you're applying to, there's a certain amount that you can basically give them a star to let them know you really like them. Like you have like sort of a residency crush on them, so to speak. Um, and then sort of from there, the interviews sort of roll out over the course of a couple months, sort of similarly to medical school, I would say.
Mm.
Anywhere from like September to late January. That's usually when they stop. And then you have about a month in February to rank your list in terms of like from highest to least of where you'd want to go. So unlike medical school, and this is I think a challenge of residency applications, it's medical school you can sort of get what you got into, make a reflection, and then sort of accept which one you want to accept. Residency is a little different. It has this thing called the match, which I'm sure you may have heard
Yeah.
of at some point. But essentially, the match works is you rank the programs in order of what you want, and then the programs rank everyone they interviewed, and they sort of use this algorithm to like match you up to your highest. So it favors the applicant, so it matches you up to your highest possible match that you can get. And then whatever you get, you have to go. So it's not like you can get off 6 offers and then you pick one. This is like, okay, this is the program you're matched to, and you're going to be here for X number of years. So that's a little different, I think.
Yeah.
But overall, it's not a bad process. I think it might change obviously by the time you guys apply because of COVID, a lot of interviews were virtual,
Mm.
which I actually did my med school interviews in person, which I think has its advantages in that you really get to get a better feel of the place. I think it could be a bit challenging to get a feel of the place just by doing an interview. So I think residency is starting to shift back to doing in-person stuff. Some programs may sort of stay permanently virtual. But what I will say, especially for med school interviews, if they do stay virtual, which they might, again, just for like, I think for good reasons in terms of like financial barriers, in terms of people applying and that sort of thing, like these are really good reasons to have them virtual. But like, think about those second looks if you do get in, like really highly consider them. Don't just like pick a school because it has a great name, because you might go there and not feel like you're a good fit at all. And I think that's a really important thing with med school, like really vibing out the situation and finding like, are these people that I'm going to be with for the next 4 years? And it's the same thing with residency, but are these people I'm going to work with for the next couple of years? Like people I vibe with? Is this an institution that I sort of get along with? I think with medical school, you'll see some programs I think really push research on you. Some programs are more like very community focused, and some programs sort of find a nice balance, I would say. And you got to sort of like figure out what is going to work best for you and like where your interests align. But
Wow. All right. So it's good to hear that, well, it's reassuring to hear that residency has like, is a little different in terms of like how there's less things that you need to like, hit
yeah,
home.
I think there's less sort of like trying to cover 10 different bases at once, whereas I think you're doing that in pre-health a lot of the time. But
There's so much in pre-health. Yeah.
yeah.
Um, but I think one of the good things about residency is that you're able to choose a specialty that you actually enjoy. Yeah. So I assume that
Like,
that must have been a highlight for you at least.
for
For
sure.
yeah, and that kind of also leads into my next question. You are doing psychiatry. So of course, I'm assuming that you are. Are you excited for residency? And also, do you want to elaborate on your future goals as a physician? I kind of wanted to know why psychiatry specifically, and what do you hope to do after residency?
Sure. That's a question I'm a little more polished at because I had to do that for a lot of interviews.
There you
I
go.
think, but it's a good question. So I think with any med student, you'll find sort of like some people come in and they know exactly what they want to do because of some sort of pre-life experience or something like that. Other people have no idea, and some people are sort of like at an early branching point can figure out what they want to do. I think for me, I came into medical school not really knowing what I wanted to do. I mean, I really liked working with like child adolescent populations, so that was something I had some interest in, but I wasn't like totally necessarily sold on like just doing pediatrics or something like that. So I really wanted to figure it out. Um, I think sort of I really love teaching and I love working with families, and I think some people in the preclinical curriculum sort of figure out that that's really what they like and they want to do. Other people really use the clinical year to like actually try out these different specialties and sort of get a sense of what works for them and what doesn't. Um, so I didn't come in thinking psychiatry, to be totally honest with you. It
Mm,
wasn't really on my radar of options. I think my first branching point was I decided I was not going to be in any sort of surgical specialty.
mm,
And I think for me, that came down to like what sort of work I wanted to do day to day. I didn't really like the OR very much. And I think also for me, I just wanted to find a career ultimately that had a good work-life balance. So that sort of like pushed those specialties to the side for me. And I was really looking at like medicine and pediatrics and physiatry and psychiatry. In our preclinical curriculum, I like absolutely loved it. I thought it was super fascinating. We got to do these like psychiatry interviews, which are actually a little different than your traditional medical interview.
mm,
Pretty early on in our clinical curriculum, and I was like, these are so amazing, and you really like get to meet these patients, get to their level, and work with them in a lot of different ways. And I think for me, I like found psychiatry because of the other interests I had outside of medicine almost, where like I really, to me, the importance of medicine is always like sort of like maximizing somebody's potential outside the hospital. Sort of, I really liked working like with social situations. So like, oh, like how do we make this work for you outside of work? Like what's going to work and what's not going to work. Sort of being able to work with families, and then also so ultimately like long-term career goal. I think I want to do child adolescent psychiatry. So that's
mm,
like a fellowship post psychiatry residency. And so that's sort of where my child adolescent sort of like interests come in. And I think with that, you really have to like really like working with families and really sort of be like very multi-oriented in your solutions. Like you're sort of like calling schools and calling teachers, and you're calling parents, you're calling social workers sometimes, and sometimes you're working with like ACS. So there's a lot of like really interesting, unique points that you can work with people. And then you also see like a wide range of conditions. There's people who come in with sort of like bread and butter depression. There's people who come in with like frank psychosis. There's people who come in with sort of delusional disorders, personality disorders. So I think there's like a lot of really cool things we could do.
mm,
And we like get to really help people in a lot of different ways. And also we're like medical doctors too, right? So we still have to respond to sort of like certain like medical level, like at least basic level medical care we need to be able to provide on like a psych unit or like an outpatient unit. And there's also like certain things that like I would need to look out for as like the head of the psychiatry team, right? So like I'm gonna learn in residency sort of like how to do therapy and sort of like how to do certain like sort of soft social things that I didn't necessarily learn in medical school in terms of being a good provider in that sense. But also I get to rely on my medical training in other ways, right? Where it's like, oh, this EKG reading is showing this, so maybe we need to stop this medication. Whereas like other people on the care team, which are like incredibly important, right? Like nursing staff, social work staff, like therapy staff, like psychology staff, like have really unique, important skills that like I sort of bring this like medicine skill plus some of these other things to the table too. So I think we really get to work in a lot of unique fields. I think it's the best specialty, but that's just me. And I think, I think there's a nice balance of inpatient and outpatient. I think long term, I want to do outpatient. I don't like love working in the hospital every day, but I sort of have the option to do both, and I get to explore both in residency. So really get to figure out like where my niche is in that sense. So that's my long-winded answer for why I like psychiatry. And I also, like I said, I think to me it was important to find a job long term that was going to be really good for me and like work-life balance. And I feel that psychiatry, I mean, while day in, day out, you're dealing with some really difficult stories, and sometimes you really have to try really hard not to take work home with you. Just because you're hearing a lot of really traumatic experiences for people sometimes. But sort of like the sort of work-life balance is really good compared to some other specialties. I think they like really prioritize like physician health and psychiatry, whereas sometimes that gets a little lost sometimes.
mm. Wow, so that's amazing. And I've started to notice that like there's a trend with kind of like your progression through the medical journey of how you started off with being inspired in terms of like educating others, and now you want to like work in adolescents. What was it again? I'm sorry, adolescent
Yeah, it's child and adolescent psychiatry. So you a
child.
little bit of, yeah.
Like, right. So yeah, I love to see how like that just like came back around in the end. So that's really cool to see. Um, and yeah, I mean psychiatry, I feel like is a very underrated specialty. I feel like it's very important.
It's becoming
especially
more popular. People are really starting to like it. It's becoming more and more
actually,
competitive. So I'll say that there's love is growing for it, which is a good thing, I think. But
yeah. I mean, I've volunteered in the ER, and I've seen how like, especially how important psychiatry specifically is for like emergencies too, right? So I
oh yeah,
mean, psychiatry, yeah, it's very important. Thank you for contributing to that world. And you know, we here at Hunter are cheering you on to see how it goes for you. Those are all the questions I have. We did this interview did go very fast. um, do you have any final words?
yeah, like you guys are here for me. Like I said, most alumni I would say are here for Hunter students too. So like feel free to reach out to Camille to have her reach out to me. Could be basically anybody who's listening. Like if you have any questions or any, you want advice or something like that, or a couple years down the line, you have an interview at NYU and you're really nervous about it and you want somebody to talk to about it. I mean, I know as a like a pre-med student, I definitely would have appreciated that and sort of like getting a perspective of a current student. So I'm like or resident, whatever, I'm more than happy to help reach out in terms of that aspect. And I know it's a long journey, but y'all are very smart and capable and you'll get there. You know what I mean? I think there are many examples in front of you and there'll be many examples behind you that can definitely do it. So I think it's just like it's a lot of work, but sort of stick in there sometimes. I know it could be hard. I know now it's like summer times. It's a little nicer, a little easier, a little less stressful. But just keep working towards you want to do, sort of remind yourself like what are the things you really want to do and like why you care about medicine and that sort of thing. And I think it'll ultimately work out in the long run.
Mm.
And like I said, same thing. This is all pre-health, right? So like anybody, like NP, dentistry, like vet. I have many friends from Hunter College now that were a couple years out, and I have dentist friends now. I have vet friends now. I have doctor friends. So you'll all make it with whatever your journey is going to be. And like I said, some journeys are going to be a little different than others, and I don't think that's a problem. I think that's an amazing thing. And I think, like I said, even if you end up going to vet school or dental school or med school like 5 years after undergraduate, I think you would have had a ton of life experience that will prove very valuable in like your long-term ability to be like a good physician.
Okay, thank you so much for that advice. I will be taking you off on that offer for the and when my NYU interview hopefully comes around. Yeah,
It sounds good. I look forward to speaking again.
well, thank you so much, Dr. Mazzeo. Actually, that's actually one very quick question. How does it feel to be called doctor now? I know that's the goal.
um
So,
I'm still getting used to it. No, I think that's totally fair. I think it's a really weird thing, you're like not quite used to it yet. And I've like joked about it with some of my PhD friends too, sort of who have all just started like finishing their programs. I think it's cool, don't get me wrong, but it also definitely provokes a little bit of an anxiety, especially like knowing that in 2 weeks I'll be in the hospital and patients are like looking to me as sort of like the sort of purveyor of knowledge in a lot of ways and sort of being able to manage care. I think it's something that you get more comfortable with over time. But it's still like it's really exciting. I think it's in a lot of ways it's sort of the arc of like a very long journey for me. And I'm sure you feel that way too. I think even just being in pre-health for a couple years feels like a very long journey, especially like starting from high school and sort of like just starting. But like once you sort of reach that point, it's like a very cool point to sort of stop and reflect and be like, wow, I actually like really accomplished a lot up to this point. I know there's like a lot more I want to do with my career, and residency is a big training point too. So there's still like a lot of things I know I'm going to learn and see. And like, that's all really exciting. But I think, again, it's a point to stop and reflect and sort of say like, wow, like, look at how much I accomplished. You know what I mean? I think same thing could be said about finishing your bachelor's degree too. I think you're going to finish Hunter College in the next couple of years and you can look back and be like, wow, look at how much I accomplished. You know what I mean? Same thing with like getting into a professional school. You'll feel the same way. So I think really take those life milestones and be able to reflect on them and be proud of them. You know what I mean? So
all right. Well, thank you so much, Dr. Mazzeo. Best of luck on your residency at Mount Sinai. I might bump into you.
sounds
Uh,
great. Yeah, I'll be around. So
and again, have a wonderful rest of your day, and thank you so much for coming in today.
thanks
Or
so much. I appreciate it. Bye.
bye.